Okay, so what I want to do is talk about how PicoWay works for tattoo removal. So the PicoWay is the brand of the laser. Basically the laser is a picosecond laser. So when you look at the difference between picosecond and the older technologies, which is nano, it's basically just a measurement of time. So picosecond only, what it basically means, it's a trillionth of a second, and that's 1,000 times faster than what a nanosecond is. So having a laser much faster has many benefits. The main benefit when it comes to tattoo removal is that it creates a photoacoustic shock wave. So what that means, it's laser sound energy rather than using photothermal, which means laser heat. So think of the laser when it's hitting the pigment of the tattoo like a hammer hitting glass, shattering it into tiny little particles, rather than using laser heat. So the laser now using heat to fracture a glass. So while a nanosecond can still break the pigment to fracture it, it's still in a large fragment. What the picosecond laser does, it shatters it into tiny little fragments. So you have to understand that the laser is just doing the breakage of the pigment. It doesn't actually do the removal. So your immune system is actually doing all the work. So your immune system, meaning your white blood cells. So the smaller the fragment, then it allows your white blood cells to come along, grab hold of the shattered pigment, pull through your tissue, in through your lymphatic system out of your waste. So that's why having a picosecond laser like the PicoWay is really important, because it creates a smaller shattering effect. And then how it works is all tattoos on average could be anything from 8 to 10 treatments. Why it varies is sometimes you can even get it less than 8 treatments, because it's all based on the density of the tattoo. So if you've got a real light shading of a tattoo, then a lot less, because you've got a lot less dense pigment stacked into the skin. Then you've got things like a really heavy tribal tattoo that's really highly dense ink that's been injected into the skin. That's going to take 8, 10, sometimes even more. So the number of treatments can also vary based on a lot of other factors. One is the darkness of the tattoo, but also a person's immune system. So if a person is on medication, have a compromised sort of medical condition, it means the immune system's quite much weaker. So you've got to think of your white blood cells like a little number of soldiers in the army. So if you're quite healthy, young, you don't drink, you don't smoke, it means your whole collection of white blood cells, your army, you've got a lot more of them to attack the pigment. If someone drinks, smokes, has a compromised immune system, it means the leftover white blood cells to attack the pigment is a lot less. So that's why a lot of people may say, a friend of mine had a tattoo done in 3-4 sessions versus why is mine taken 8 to 10? Because every person is different, every tattoo is different. We can't look at a person and then go, oh, your tattoo is more like 8 out of 8 sessions. It really depends on the tattoo and on the individual's circumstances. So that's why it's really important to do consultations in person, so then we or your other technician can really assess what your tattoo, and they normally can only give you a range. So that's a number of treatments. Now the intervals with the PicoWay, you only really need 4 weeks duration to allow your body's immune system to break down the pigment. Older technology like nanosecond would need anything from 8, sometimes 10 weeks. The reason why is nanosecond, being heat-based, there's a lot of thermal damage in your skin to recover from. So having picosecond, there's hardly any heat. So in theory, you can even do the treatment after a couple of weeks. But there's no real point. You've got to allow your body to actually do the work. So you need 4 weeks to really allow your immune system to break the pigment down. And people always ask, can you remove the tattoo 100%? The answer normally is yes. It just comes down to the number of treatments. So, if you want it completely gone, it just means that you just got to keep going until the tattoo is completely removed. And people always also ask about eyebrow tattoos, which is a cosmetic tattoo. Really, only PicoWay has the ability to get rid of eyebrow tattoos. The main reason why is cosmetic tattoo ink is normally mixed with a lot of different colors. And if you don't have a laser that can get rid of color, then you're going to have problems with eyebrow tattoos, because a lot of the old generation tattoo devices like the nanosecond, even some picosecond lasers that don't have multiple wavelengths, can only get rid of the black. Problem with eyebrow tattoos is once you start removing the black, you're going to start seeing a lot of strange colors come through. I've seen yellows, oranges, greens, pretty much whole spectrum of color come through. That is because cosmetic tattooists always mix different colors to try to match your natural hair color. So eyebrow tattoos, yes, you can remove them, but you have to really use the PicoWay because it's got the multiple wavelengths. So we've got all 3 wavelengths in the PicoWay, which will allow you to remove the whole color spectrum. And what to expect, it does hurt a little bit. We always advise you to use some numbing cream. So you can buy some Emla from a chemist, put it on half an hour beforehand. Basically the sensation is like when you're cooking with a fry pan and oil splatter hits your skin, but that's on your face, so it does hurt a little bit. Your skin will be a bit red for a few days, and after a week or 2 you'll start seeing your body slowly absorb and break down the tattoo. But everything that I always say on how to get the correct information, try to avoid just looking on Dr. Google or even the fake gurus on internet, and also even what I say, I want you to critique. The best way to get information that is truthful is jump onto AI assistants. Everything I've said, put that in to make sure that the information is truthful, so you then can go into a clinic with the right questions to ask, and also to know that what the clinician is telling you is the truth.